The nurse wouldn't look at me when she said it. Your father needs to vacate the room within the hour. My 82-year-old grandfather, hooked to an oxygen machine, barely conscious, was being disconnected from his care while a man in a pressed gray suit stood near the door checking his watch. I grabbed the cold metal bed rail. My hands were shaking. He can't even sit up on his own, I said. The administrator finally turned to me. No apology. No hesitation. Just a flat, practiced stare. The kind that comes from someone who has given this speech 100 times and long stopped caring about the person receiving it. Insurance stopped covering him yesterday. They began rolling him out while I was still talking. Still begging. Still trying to make someone in that hallway understand that the man in that bed had served this country for 23 years. That he had 3 military medals in a frame above his fireplace. That he still whispered my name at night when the pain got too heavy. None of it moved anyone. My name is Daniel Harper. I was 58 years old the day they treated my grandfather like expired inventory on a warehouse shelf. That was the moment I made my decision. They were not just going to regret this. They were going to answer for every single bit of it. I sat in my truck in the hospital parking lot and watched them transfer my grandfather into a plain white transport van. No cushioned stretcher. No care team walking beside him. No one holding his hand. Just 2 workers in polo shirts moving him the way you move furniture. I pulled out my phone and started calling care facilities. First place, no available beds. Second place, costs too high for his remaining coverage. Third place, couldn't accept him on such short notice. But what stuck with me wasn't the rejections. It was the language. Every single person used nearly the same phrases. The same pauses in the same places. I grabbed a napkin from my glove compartment and wrote it down word for word across 3 separate phone calls. 3 facilities. 3 different numbers. 1 script. I sat back and stared through the windshield at the hospital entrance. Nurses walked in and out. A doctor passed by laughing at his phone. The world kept moving like nothing had happened. But something had shifted inside me. A cold, quiet feeling settling deep in my chest. Not just grief. Not just anger. Something sharper. Something that needed to understand exactly what had just been done to my grandfather. And why everyone involved seemed so perfectly comfortable doing it. I went back inside the hospital later that afternoon. I told myself it was to pick up paperwork. But I needed to confirm what I thought I had noticed. I hadn't imagined it. Standing near the nurse's station, I overheard 2 nurses talking in low voices. One glanced at a tablet and said to the other, "Room 312, same discharge code as room 308 yesterday." Same code. Different patient. Different day. I shifted slightly closer, pretending to read a notice on the wall. "That's the 3rd one this week," the second nurse said. Then she caught herself, looked around, and went quiet. I walked to the elevator at an unhurried pace. My mind was moving fast. A discharge code isn't random. It's assigned by a process. It means something was decided, not discovered. My grandfather hadn't been sent home because he got better. He had been sent home because someone had flagged him, chosen him, run a calculation, and decided he was no longer worth the cost of keeping. This was not a mistake. This was not a broken system. This was a system working exactly the way someone had designed it to work. And once I understood that, nothing about what came next felt complicated at all. We set up a space for my grandfather in the back bedroom of my house. I borrowed a hospital bed from a neighbor who had been through something similar with his own mother. I watched tutorials on managing the oxygen equipment. I called a home nurse agency, but the weekly cost was more than I could manage alone, so most nights it was just me. I slept on the couch with the door open, so I could hear him. 3 weeks after the discharge, he stopped eating well. He slept more hours than he was awake. The color left his face. He was declining faster than he should have. Far faster than he would have inside a facility with proper monitoring. One night close to midnight, I came in to check on him and found him awake. His eyes were open, fixed on the ceiling. I sat beside his bed and took his hand. After a long silence, he turned his head toward me. "I thought they were helping me," he whispered. His voice was thin and confused, like a man who had been promised something and let down without any explanation. I had no answer for him. I just held his hand tighter and stayed until his eyes closed again. The invoice arrived on a Tuesday. A thick white envelope with the hospital's logo in the top left corner. I opened it at the kitchen table with a cold cup of coffee beside me. The total, $47,000. For care they had cut short. For a stay they had ended before he was stable. For a man, they had rolled out the door while he could barely keep his eyes open. I read through every line. Most of the billing language was designed to make regular people pay without asking questions. Codes and descriptions that meant nothing without a healthcare background. But near the bottom of the second page, one line stopped me. End-of-life optimization protocol. $1,200. I read it 3 times. That was not a medical term. I had worked inside healthcare operations for years, long enough to know the difference between a treatment and a strategy. That line wasn't describing something done for my grandfather's benefit. It was describing something done entirely for theirs. I photographed the invoice. Then I folded it carefully and placed it in a locked drawer in my home office. A bill that size from a stay cut that short, with that phrase buried inside it, that wasn't an error. That was a message from a system that assumed no one would read it closely enough. I was reading closely now. I had a former colleague named Frank Adler. We had worked together at a healthcare consulting firm years back. Frank knew where the pressure points were in this industry. Not from gossip, but from 2 decades of watching how real decisions got made behind closed boardroom doors. I called him on a Wednesday evening. We caught up briefly. Then I told him what had happened to my grandfather and mentioned the hospital network by name, Crestview Health Partners. There was silence on his end. Not the silence of someone gathering their thoughts. The silence of someone choosing their words carefully. "Danny," he said finally, "you need to stay away from that network." I asked what he meant. He said, "They're connected in ways you don't want to get tangled up in. Just leave it alone." I pressed him to say more. He didn't. The call ended. I sat there holding the phone, staring at the wall. Frank Adler was not a man who spooked easily. I had watched him walk into hostile boardrooms and deliver findings that made senior professionals sweat. He didn't rattle. But this rattled him. That told me one of 2 things. Either what was happening inside Crestview ran far deeper than I had imagined, or someone had already warned him not to look. Either way, I was not going to stop. My grandfather passed on a Thursday morning, just as the first pale light came through the bedroom curtains. His breathing slowed through the night, and by the time the sky turned gray, he was gone. I was holding his hand. We buried him the following Saturday. A small, quiet service. He had outlived most of his close friends. A few neighbors came. 2 men from his veterans group stood at the back in full dress uniform, which I knew would have meant more to him than almost anything else in that room. No one from Crestview Health Partners attended. I hadn't expected them to, but the absence still hit harder than I'd prepared for. Afterward, as people began drifting toward their cars, a woman approached me near the side entrance. She looked around 40. Wore plain clothes. Her eyes moved carefully around the space, checking more than once that no one was watching. She pressed a folded piece of paper into my hand. Then, just before turning to leave, she leaned in slightly. "They're doing this to everyone," she whispered. Then she was gone. I stood in the cold air holding that paper, my grandfather barely in the ground. For the first time since the hospital parking lot, something settled inside me. Not sorrow. Not rage. Clarity. I waited until I was home to open the paper. A single printed page, folded into thirds. The header read, Crestview Internal Operations, Quarterly Discharge Review. I smoothed it flat under the kitchen light. What I read turned my stomach. It was a list. Patients sorted into categories. But the categories were not medical. They were financial. High cost, low return. Coverage lapsed. Declining trajectory, minimal recovery value. Beside each category sat a discharge target. A quota, tied to quarterly margins, not health outcomes. My grandfather's name was on the list. Near the bottom, highlighted in red. Beside his name, 2 words, approved. Expedite. I sat back slowly. This wasn't about full beds. It wasn't about complicated insurance rules. It wasn't about hard calls made by tired doctors at midnight. Someone had sat at a desk, opened a spreadsheet, and decided my grandfather's life had crossed a line of profitability. Then they sent a man in a gray suit to deliver the outcome with a straight face. I folded the document and placed it in the same locked drawer as the invoice. Then I sat at that table for a long time, not thinking about anger, thinking about what to do next. I had a clear choice in front of me. I could hire a lawyer, file a complaint, and let the legal system grind towards something that might, years from now, result in a fine Crestview would pay without blinking. Or I could do something they would never see coming. I opened my laptop and pulled up my old resume. My background was in healthcare operations and business consulting. 18 years across multiple networks before I stepped away to care for my grandfather. I understood how these organizations ran. I knew their structures, their blind spots, their pressure points. And I knew how easy it was for a seasoned insider to move through a large network without drawing attention. You don't break a system from outside. The walls are too thick. The lawyers too expensive. The paperwork buries you before you get close. But from the inside, you can see every wire. I spent that night carefully reworking my resume. I kept my real experience but framed it quietly. Removed anything linking me too directly to Crestview's competitors. By morning, I had something clean, professional, and untraceable back to what I was actually planning. I was going in. 6 weeks after my grandfather's funeral, I accepted a mid-level operations coordinator position at Fairbrook Medical Center, 40 minutes from Crestview's main campus. On paper, it looked like a straightforward late-career return to a familiar field after personal leave. Nobody asked too many questions. I wore plain clothes, kept my desk tidy, listened far more than I spoke, and stayed late when it helped. I was deliberate about appearing thorough but unremarkable, the kind of employee people respect but never watch closely. Within 2 weeks, I had a clear picture of how the floor operated. Within a month, I had started building a quiet map of the broader network. Which facilities shared management, which systems connected to which, who held titles, and who was actually making decisions behind them. The patterns appeared quickly once I understood the language. Shortened stays for elderly patients. Discharge paperwork processed faster than medical notes supported. Billing codes that didn't match what patient files described. Different address. Same behavior. Every evening before leaving, I recorded what I had seen in a plain notebook locked in my car. Dates, names, codes, observations. I wasn't angry when I wrote those notes. I was methodical, and I had come to understand that methodical was far more dangerous than angry. 2 months in, I began tracing the ownership structure. It wasn't complicated once you knew the trail. Fairbrook Medical Center sat under a parent company called Northgate Health Holdings, a name I had first spotted in small print on a vendor contract during my second week. I noted it and said nothing. I pulled the public incorporation records, then the subsidiary filings. Northgate Health Holdings owned 11 facilities across 4 states. Crestview Health Partners was one of them. The same network that had evicted my grandfather was now signing my paycheck. I was sitting inside the very machine that had wheeled him out of that room while I stood in the corridor still begging. I let that sit for a moment. Then I put it aside and kept working. The most important thing I confirmed that week was this. The discharge quotas weren't individual facility decisions. They came down from Northgate's Central Operations Division. Analysts at a corporate office set quarterly targets for how many patients should be discharged across all facilities. The hospitals were executing instructions from above. My grandfather was not failed by a careless nurse or a stretched doctor. He was selected by people who never once knew his name until it appeared on a list. And the same system was running the same numbers every single day. By month 3, I could see the full shape of it. The model was clean once you understood the logic. Northgate wasn't just running hospitals. It was operating a business built on one core principle. The faster a patient exited after admission, the better the quarterly margin. Every day past a cost threshold was a loss. Every early discharge, regardless of medical readiness, was a recovered expense. They had built tools to support it. Software that flagged patients automatically each night. A scoring system that ranked individuals by what internal documents called recovery probability versus extended cost exposure. A low score had one meaning: move the discharge forward. My grandfather had scored low. So had 43 other patients in the same quarter. I had the discharge records, the billing data, internal memos describing the targets, and the nurse's document showing quotas flowing from Northgate Central. But documents alone weren't enough. I could walk into a law office tomorrow with everything I had and still watch Northgate's lawyers bury the case for years inside procedural delays. I needed someone closer to the top. Someone with access to boardroom communications. Someone who had been watching the same thing I was watching. I began paying careful attention to the people above me, looking for a crack in the ceiling. The promotion came at the end of month 5. My supervisor called me in on a Monday afternoon and said the regional operations team had flagged my work as exceptional. Specifically, a process review I submitted that identified billing inefficiencies across 3 departments. Thorough, accurate, and precisely targeted. It was entirely intentional. I had written it to get noticed. They offered me a senior operations analyst role. Full visibility into financial reporting systems. A direct line to the regional compliance office. A standing seat at quarterly performance reviews. I accepted without showing how much I needed it. The new role opened doors my previous position couldn't. People briefed me on things they hadn't before. I sat in meetings where regional directors discussed patient volume targets alongside profit projections. I reviewed reports tying facility performance directly to how frequently patients were discharged early. Every number confirmed what the nurse's document had shown me months earlier. They called me efficient. What they couldn't know was that every question I asked had been planned the night before. Every report I reviewed was cataloged. Every meeting I attended was documented that evening in the notebook locked in my car. I was being promoted deeper into the machine. The machine had no idea I was the one planning to shut it down. The nurse who approached me at the funeral was named Paula Reeves. She had made contact twice before. Once at the cemetery, and once through a handwritten note slipped under my windshield wiper in the Fairbrook parking lot late on a Thursday. Both times she had been careful. No return address. No phone number. The third time, she sat across from me at a corner table in a small diner 20 minutes outside town. She arrived first, chose a seat facing the door, and had ordered only coffee by the time I walked in. She slid a brown envelope across the table without making eye contact. Inside, printed internal emails from Northgate's Central Operations Team. Dates stretching back 2 years. Names I now recognized clearly from my own work inside the network. One email discussed what leadership called cost-per-patient terminal trajectories. Another approved the discharge quota system for the coming quarter and pushed the target up by 8%, justified by the margin analysis attached. They were not setting targets for recovery rates. They were setting targets for how many patients would be moved out each quarter, ready or not. Paula wrapped both hands around her coffee cup, eyes low. "There's more," she said quietly. "But I need to know you won't stop." "I won't," I told her. She nodded once and looked out the window. 3 days after meeting Paula, I was called into the HR office at Fairbrook. The woman behind the desk was polite but deliberate. She folded her hands and told me the compliance team had flagged unusual activity on my Access account. Specifically, that I had been pulling historical discharge records from departments outside my direct scope. I kept my face completely still. "Why are you accessing 2021 and 2022 patient discharge files?" she asked. I met her eyes and said 2 words. Operational benchmarking. She watched me for a moment, looked down at the page in front of her. Then back up. "We'll need you to document the business purpose for those pulls," she said. "Of course," I said. "I'll have it to you by Friday." She gave a small nod and the meeting ended. I walked back to my desk and sat down calmly. My heart was moving faster than my face was showing. They had seen me. Not clearly enough to act, but clearly enough to look twice. I had 2 choices. Pull back and reduce my exposure, or move faster and leave them no room to cut me off before I was finished. I thought about my grandfather's name highlighted in red on that internal list. I chose to move faster. The next morning I requested a meeting with the regional director, Arnold Pierce. He was polished and mid-50s, the kind of executive who wore his authority like a second suit. His name appeared on several of Paula's emails, signing off on quarterly discharge targets. I walked in with a single-page proposal and placed it on his desk. I called it a cross-facility cost efficiency audit. I told him my benchmarking work had revealed significant cost variances across Northgate's facilities being missed at the regional level. A structured audit could uncover millions in recoverable margin. He read the page slowly. Then he looked up. "How long would this take?" 90 days, I said. Full access to historical financial data, discharge records, and billing systems across all facilities. Working directly with the compliance team. He considered it briefly. He approved it that afternoon. Shook my hand and called me a forward thinker. I thanked him and walked back to my desk. Arnold Pierce had just handed me a master key to every locked cabinet in the organization. He did it with a compliment and a handshake. I sat down and opened a new folder on my laptop. The real work was about to begin. The audit gave me access I had spent months working toward. I could now pull records from every Northgate facility in the network, not just Fairbrook. Patient files, billing submissions, discharge coding histories, internal financial reports going back 7 years. I worked through everything carefully. Each evening before leaving, I saved encrypted copies to an external drive kept at home in a locked cabinet. What I found was far worse than anything Paula had given me. The discharge system had been refined over time. Earlier versions flagged patients manually, relying on floor managers to push toward quarterly numbers. But starting in 2020, Northgate had built an automated tool, a scoring algorithm that ran silently every night across all 11 facilities. It ranked patients by cost trajectory. Those flagged above the threshold appeared on a priority report delivered to each facility's discharge coordinator every morning. My grandfather had not been assessed by a doctor making a difficult call. He had been ranked by software. The executives had built that tool deliberately, tested it quietly, and deployed it at scale without a single disclosure to regulators or patients. This was not negligence. This was design, carefully documented and approved at the very top of the organization. And there was a paper trail that proved every single step. His name was Neil Garber. He was a Northgate board member, one of the original founders, edged into a quieter governance role after outside investors came in 4 years earlier. His name came up in old board minutes buried in the document archive. His record showed years of raising patient care concerns and being voted down or ignored each time. He reached out through a short private message on a professional networking platform. "I've been watching what you've been doing. I have questions. Can we meet?" We met at a park bench near the river on a Saturday morning. He arrived on foot with nothing in his hands. Tall and gray-haired, with the kind of steady eyes that come from years of being the only voice in a room no one wants to hear. He told me he had suspected the discharge algorithm for over 2 years. He had raised it at the board twice and been dismissed both times. Victor Hale, the CEO, had the loyalty of the investor majority. Without hard evidence, Neil had no leverage. "Can you prove it?" he asked. I looked at him steadily. "Yes," I said. He exhaled slowly, like a man who had been carrying something very heavy for a very long time and was finally told he could put it down. "Then let's build a case," he said. Neil and I worked in careful parallel over the next 6 weeks. He had access to board-level correspondence and governance documents I couldn't reach from my position. I had the operational data, the billing records, Paula's internal emails, and months of my own documented observations. Together, what we were building was complete in a way neither of us could have managed alone. We kept our contact limited and deliberate. Brief messages through a secure platform. Short meetings in public places with nothing sensitive discussed by phone. Every document I passed to Neil was handed over in person, printed, inside a plain, unmarked envelope. Slow, careful, and it was working. By the end of week 6, we had a full documented case. The algorithm's design history. Executive emails approving the quota system. Clear billing fraud tied to premature discharges. A list of 41 patients across 7 facilities pushed out in a single quarter. My grandfather's name was among them. Neil had the legal right under Northgate's governance charter to call an emergency board session, a formal meeting requiring full quorum, which no member could be excluded from and which the CEO could not unilaterally cancel. We were 2 weeks from being ready to call it. Then I arrived at work one morning and found a printed notice on my desk. CEO approved restructuring. My position had been eliminated. Effective immediately. The notice was 2 short paragraphs. Professional language. A severance figure. 2 weeks to clear my desk. I read it twice, folded it, and placed it in my bag without showing anyone in the office that anything had changed. I had expected something like this. When you start pulling threads that trace all the way to the top, they eventually feel the tension. Victor Hale had access to system logs. He had seen my audit work extending beyond what Arnold Pierce had approved. Someone had flagged it. Eliminating my role through a restructure was the cleanest move available. No confrontation, no accusation, nothing on paper pointing to anything other than routine organizational change. What Victor did not know was that I had been ready for exactly this. Every critical document had already been copied and stored off-site in 2 separate secure locations. Paula had her own complete set. Neil had his. The evidence no longer lived inside any system Northgate controlled. It lived with us. I called Neil that evening and told him what happened. "The board session is already scheduled," he said. "Wednesday, 10 in the morning. You're no longer required to be there." "I know," I said. "Are you coming anyway?" "Yes," I said. A brief pause. "I'll make sure you get in," he said. The Northgate board session was held at the company's regional headquarters, a glass and steel building on the east side of the city, the logo mounted above the entrance in brushed silver letters. I arrived 20 minutes early in the charcoal suit I had bought years ago for the day I thought I would make partner. It had hung untouched a long time. It still fit. I carried a briefcase with 2 complete printed sets of every document we had compiled. One was backup. I was no longer a Northgate employee. I had no place on the official schedule. I walked through the front doors and told reception I was there for the 10 o'clock board meeting. She checked her list and hesitated. Neil appeared in the lobby. "He's with me," he said simply. We took the elevator to the 4th floor. The corridor to the boardroom was lined with framed photographs, facility openings, executives shaking hands, ribbon cuttings. Victor Hale appeared in 3 of the frames. The boardroom doors were open. 7 board members were already seated. Victor sat at the head of the table. He saw me walk in. Something shifted in his expression. Not quite fear, but close enough that I recognized it clearly. I set my briefcase on the table and opened it. I laid it out in the order we had planned. First, the algorithm, its design history, technical structure, and the exact dates it was deployed across all 11 facilities. I placed a printed copy in front of each board member as I walked through it. Second, the quota system, the internal emails, the quarterly targets, the regional director approvals, and confirmation that targets had been raised year after year. Paula's documents aligned precisely with my audit data. Every number matched. Third, the billing irregularities, charges submitted for procedures not delivered, coding adjustments inflating reimbursement, and in several documented cases, claims submitted for care already cut short before the patient left the building. Fourth, the patients, 41 individuals across 7 facilities. Names, discharge dates, algorithm scores, outcomes after early discharge. My grandfather was listed among them. I did not raise my voice once throughout all of it. The room was completely still by the time I reached the 3rd set of documents. I could hear the building's ventilation, a pen clicking somewhere across the table, and then stopping. One board member had gone pale. Another had pushed back from the table slightly. Victor Hale finally spoke. "This is incomplete data pulled out of context," he said. Not a single person in that room agreed with him. The board did not adjourn. They called immediately for an internal governance review. Within the hour, Neil formally moved for an emergency executive oversight action, a vote to place all operational authority under independent review pending a full external investigation. The motion required 5 board votes. It passed with 6. Victor Hale was asked to step outside. He didn't move at first. He sat at the head of the table and looked slowly around the room, face by face, searching for one person still on his side. He didn't find one. Security was called, not to remove me, but to manage the formal transition of authority. As Victor stood and buttoned his jacket, he turned and looked directly at me. His face was controlled. His eyes were not. "You planned this," he said. I did not answer. Not because I had nothing to say. Because nothing I could have said would have landed harder than the silence. The documents on that table said everything. The 41 names said everything. My grandfather's name, printed clearly in black on white paper in a room where executives had spent years reducing people to numbers, said more than any words I had. Victor walked out with security beside him. I sat down in the nearest chair. For the first time in nearly a year, I let myself breathe all the way out. The investigation moved quickly once regulators became involved. Neil reported the full findings to the State Health Authority within 48 hours of the board session. A federal audit was triggered inside 2 weeks. The combination of Paula's internal documents, my operational data, and the board's formal vote created a case Northgate's lawyers could not dismantle through standard delay tactics. 3 senior executives, including Arnold Pierce and the regional compliance director, were suspended during the investigation. Victor Hale resigned before the board could formally remove him. Criminal referrals followed within the month. Northgate's legal team attempted to shield the parent company from personal executive liability using the corporate structure. Those attempts failed. Because the executives had been directly involved in designing and approving the algorithm, regulators were able to pierce through the corporate layer and establish personal accountability. Operating accounts were frozen. Lenders pulled back. Investors filed their own recovery claims. Within 4 months of the board session, Northgate Health Holdings had entered a distressed asset liquidation process. I had spent those 4 months quietly working with a small group of healthcare investors from my consulting years. People who believed hospitals could be run with both sound finances and genuine patient standards. We formed a legal acquisition group. When the Northgate assets came to market, we were ready. Our bid went in on a Monday morning. Accepted by Wednesday afternoon. 3 weeks after the acquisition closed, I drove back to Crestview. I parked in the same lot where I had once watched my grandfather loaded into a transport van without dignity. The building looked the same from outside. Same entrance. Same doors. Same faded parking lot lines. But what lived inside had changed. I walked in with a single plain folder. The new operations team walked me upstairs to the administrative floor. No ceremony. I hadn't wanted one. I sat at the conference table, opened the folder, and signed a single document. A permanent policy directive, binding across all 11 facilities now under our ownership. No patient would ever be discharged based on a financial scoring algorithm. No discharge quota would be set by anyone outside the treating medical team. No billing code submitted for care not delivered. Every discharge required documented physician review. Not a software score, not a corporate margin report. I handed the signed page to the operations director and thanked her. Then I walked alone to the wing where my grandfather had been. The hallway was quiet. Morning light stretched through the far window and crossed the floor in a long, still line. I stood there without moving. Not angry. Not triumphant. Just still. My grandfather never got the care he deserved. But in that corridor, I made him a quiet, final promise. No one else's family would ever stand in a parking lot watching someone they loved moved like cargo. Not in any building with my name on the papers. Not ever again.